We are back on MorningLine. We're talking about, oh, it says hearing health on the screen there, and that's a good topic. 737-7587. If you want to join the conversation, we got some lines open, but I know a lot of you just like listening to the good doctors with us. Noreen Gibbons is with us this morning, along with her resident in audiology, Meryl Geiger. Nice to have you both on. You know, before we get into the hearing aids, short of a toothache that just sits there, an earache, those are two of the worst chronic little things you have. And boy, that's when, thank goodness for audiologists, thank goodness for dentists. Yeah. Now these days, children especially, I've had several friends that have small children that have had was it stint that goes
tubes
put in to drain, and is the drainage coming from the sinuses, or where's it? What is going on there?
In children, the sinuses are connected to the middle ear through the eustachian tube, and the eustachian tube is responsible for exchanging air in the middle ear. For children, it's more on a horizontal plane, and they get a lot of colds and upper respiratory infections that create the potential for fluid in the middle ear. So the tubes are put in not only to drain what fluid is in there, but to keep the fluid from building up to begin with.
Which gives you the earache.
Correct.
Now, will kids outgrow that eventually?
Most children do. Yep, most children do, because as they grow, the eustachian tube gets more vertical slope to it, so it doesn't drain as easily.
Was there something that caused that to happen more frequently in recent history in kids, or has it always been there, we've just been able to treat it and diagnose it better? Or something genetically gotten worse somehow with kids? Well,
we used to see a lot of people that had mastoid surgery. In fact, when I was at Vanderbilt as a student, we'd see a lot of mastoidectomy patients, and those were people who had such chronic infections that they literally had to go in and remove the entire portion of the middle ear that had all that inflammation, or you can get something called a cholesteatoma. So in the past, they didn't do the tubes as much, but those other problems came up. So the tubes are an important improvement.
Sure, that's a lot better than taking everything out.
Yeah.
All right, let's go to Grady. Grady, good morning.
Good morning.
Hey.
You know, we had this fellow one time that they gave him headphones or headgear to help improve his hearing because the noise level was getting to him, and his ears kept not improving. They got worse, and they got to checking his earmuffs that he was wearing, and he had cut the inner liner out that was supposed to be protecting because that was bothering his ears.
That's not gonna work.
Been around racing all my life and race cars, you know, and the noise level they put out, you know, and a lot of the guns that I shot, you know, were super loud and 30-06 and the shotgun. But, you know, I mean, you can tell the difference, but sweet oil is what we've always used, you know, to help with their earache.
What is it? What's it called?
Sweet oil.
Sweet oil is,
you know what that is? Okay.
Yeah, it was pretty common to hear that from people for the earaches, and
Is this an oil you drop in the ear?
Yes.
And what is, you know, sweet oil? What's it from?
It's well, Meryl, do you know actually what sweet oil is from?
I don't know exactly what it's from.
Yeah.
No.
That was a little more of an old school approach to reducing ear infections. I have a lot of people will tell me their moms used to do that, or their grandma. Heat, like a washcloth and warm or a heating pad, something like that will help reduce an earache. You still want to treat the problem that's causing the earache. For adults, earaches are typically pain referred from the jaw or the throat, or TMJ issues. Those are all more common for adults. For children, you got to treat the source of the problem, but then also pain relievers or a heating pad, something to reduce the pain. But yeah, sweet oil. I do want to go back to the people who need to communicate when they're in real noisy environments. That's a big issue, that people don't want to wear hearing protection because then they can't communicate. There are electronic muffs available that will allow a little bit of amplification but still protect when noise gets loud enough. And those are available at most sporting goods stores. And then also you can get a custom hearing protection that's the same sort of thing, but it's it looks like an in-the-ear hearing aid, but what it is it's got a microphone that gives just enough amplification but shuts the sound down or compresses it when it reaches a certain level, and that will help protect hearing.
Okay.
Of course, again, as we talked about, if it's loud enough, it's going to go
get to you.
right through those bones.
I mean, Meryl, have you ever been to a NASCAR race?
I actually have.
Okay.
When I was young.
That's the loudest sporting event I have ever been to. I remember noticing people in the stands. I didn't know really. I'm not the hugest NASCAR fan. I had just been introduced to it. They were all wearing headphones.
Yeah.
But talk about the sound. I don't think you're right. It's going to protect the ears, but it was rattling my bones.
Yeah. Yeah.
And people go to these sporting events. And by the way, Rick's telling me Wikipedia says sweet oil is like a derivative of olive oil of some type.
Yeah, thank you, Rick.
So something along those lines. But you don't recommend dropping or pouring. If you do, it's got to be extra virgin. No.
Since I didn't know exactly what it is, I'm definitely not going to recommend it.
Don't recommend that. All right, let's talk about the hearing aids that are out there. First, cochlear implants, which has been a miracle for a lot of people.
It has, yes.
Keep improving. Explain what a cochlear implant is to the folks again, as opposed to, say, a normal hearing aid.
Would you like to go ahead?
Yeah.
Well, cochlear implants are a little different. What they do, a normal hearing aid is providing amplification, so just a louder sound that's appropriate for their hearing loss.
Okay.
Cochlear implants take a different venue. There's an electrode that's placed in your inner ear, and that creates electric stimulation that then is sent to the auditory nerve. So you kind of bypass the whole hearing system in that sense with the hair cells.
Yeah.
So that electrode stimulates the auditory nerve.
Helps you hear better. So it's would you ever combine a cochlear implant with a hearing aid?
Oh, that is so good you asked.
Is that a silly question?
No, it's not a silly question.
Okay, because I was thinking, like, what made me think of it when she said it bypasses.
Yeah.
And so,
yeah, it's interesting. That's called a hybrid, and that is something that's been available in the last few years. They have started to use that more and more. So for people who have what we call residual hearing, where they can benefit from a hearing aid, we want to try to preserve that because that's a more natural sound.
I see.
But the hybrid will take care of the areas where there's no usable hearing. So it's a really promising technology. Now, for some people, once you insert that electrode, you run the risk of losing the residual hearing, and that's why people are a little reluctant. We have to really look at the medical issues and who's a good candidate. Is there reasons that they might, for medical reasons, they might lose the rest of the hearing anyway? Then you'd probably go ahead and do a full insertion. That's something the surgeons really do try to narrow down.
Makes sense.
Yeah, so there's just a few surgeons in this area that provide that surgery, and then the audiologists are responsible for referring people, for doing the testing for candidacy. There's a lot that goes into making that decision. And then follow up, the activation and the mapping, that's a whole nother process that the audiologists take over. So.
Okay, well, with those advances, one of the coolest parts of what you do must be when you've had someone who has been maybe hearing next to nothing for a while, and then seeing them hear something for the first time.
Yeah.
Have you had that happen a few times with you?
We just had that happen. We have it happen every day, but one of the most compelling stories was a patient who came in to see us recently who already had some vision issues and then had a stroke that affected the vision, so she had one seeing eye left and a severe hearing loss, and it was heartbreaking to see the impact. But I tell you, by the time she left our clinic, I think we were both feeling very happy about it.
What did you do? You were able to...
We were able to get her a set of hearing aids to go home with that day, to insert molds that we, it's an over-the-counter mold that we put on people just to get them out the door. And then we ordered her custom molds, and Meryl got to see her yesterday.
I did.
And you can talk about that a bit.
Is she hearing a lot better now?
She is. She was so thankful. She told me her daughter was in, and she said, I heard my daughter whisper, and I haven't heard her in so long.
That's awesome.
So she was just thrilled to be able to have that, to be able to hear. And she had previous amplification or previous hearing aids, but as she aged, her hearing, it seemed to have gotten worse, so they just weren't appropriate for her hearing loss anymore. So she was very excited to be able to have that.
That is so great, because it's scary. She was on the road to losing her sight and hearing.
Yeah, exactly.
And then that's got to be really terrifying.
Yeah. Yes.
And
it cuts you off from people. I mean, we talk about the difference between vision and hearing, and which one you would give up if you had to. Of course, none of us would want to give up either one.
Horrible choice.
But hearing cuts you off from people, and it was actually Helen Keller that said that, something to that effect. I'm paraphrasing there, but
yeah, it was someone who would know. She said hearing is what really cuts you off.
Hearing was the real challenge because it cut her off from people, whereas the vision loss cut her off from things. But this woman, you know, had 3 daughters that took care of her, helped take care of her, but she was unable to hear any of them until she got in and we got this solved for her. So that was a great feeling to be able to do that.
That is a great story. What a great story. Let's go to Mark. Good morning, Mark.
Good morning, Nick. Morning, everybody.
Hey, how are you?
I got a question. I got an earwax built up in my ear. Number one, what can I use to get the earwax out of my ear, and can earwax cause a loss of hearing?
Okay.
Yeah. Well, first of all, if you're sure that that's the case, and I'm assuming you've seen your doctor or someone's looked in your ear, and sometimes once people get an earwax buildup, it's common to have it happen again and again. So maintaining it, keeping it clear, is one issue. Having it removed if it's impacted should be done by your medical provider. It should be done by a primary care physician, or if they can't handle it, an ear, nose, and throat doctor. Audiologists will also do that as well. So keeping the wax from building up again, the over-the-counter solutions are very effective for preventing it building up. And one that I particularly like is called Earwax MD.
Oh, okay. That's easy enough.
Yeah.
Now, will that dissolve it, or does that just? It may help dissolve some if it's not impacted yet.
Yes, correct.
Okay.
It'll help keep it from building up. So you use something like that maybe about once a month or so.
And by the way, the temptation would be to put that in there, and someone would think, well, then I need a Q-tip to clean it out.
No.
So you pour that in, and it just starts coming out. You in the shower, maybe it rinses out.
Well, you want to be laying down, put it in, wait about 10 to 15 minutes, and then turn your head, and it will drain out.
And just maybe a napkin up here or something.
Correct. Yeah. So just use something underneath there.
Okay.
And then if hearing can be affected if you get impacted wax where it's built up so much that it's creating what we call a conductive hearing loss. A lot of times people will come in and will find that they have impacted ears, and we'll get that cleared up, and then we find they still have some hearing loss kind of underneath that wax impaction, but they're immediately hearing so much better that it's usually they feel like it's adequate for that time, and we might be a few years before we get them back in. But if you already have some hearing loss, earwax is going to create more of a challenge.
All right, let's go to Steve next. Steve, good morning.
Good morning.
Hi, Steve. How can we help you?
Yes, I just tuned in. I'm not sure if you've covered this. I have severe tinnitus, and I went to an audiologist, and the only tool that he had in his toolbox was hearing aids. And I can hear. It's just it's all this excess ringing that, and it. I'm in an environment at work where I've got to be. It's very loud. I'm doing interacting with other people, making sure people qualify for what I'm doing. And I have seen some research that they're starting using in biblical T cells and to try to
heal it, to regrow.
Well, they're claiming that it could regrow the hair follicles inside the cochlea.
All right.
Yes.
So he's looking for other options besides hearing aids.
Well, I do want to mention one thing about using hearing aids. That is typically the first thing we want to try, because very often, probably 75% or more of the people that we do this with will benefit from the masking provided by hearing aids. So I know that people get a little frustrated when that's the first approach, but the reason is because we do see such good results.
Again, this is a guy with tinnitus, or what's it called? Tinnitus is ringing in the ears.
Yes.
All right.
So the other things, the medical treatments are very promising, but they're not quite ready to be tried on humans yet. We don't have enough evidence that will show that once you start cell growth, you have to really know how to turn it off too. And in the inner ear, there's just not a lot of space for extra cells and things like that. So the research that's been done, to my knowledge, that's still on birds and other animals where they're trying to do that. It's promising, but there's nothing yet. Tinnitus is one of those things we have to manage since we can't typically cure it. One more thing, if you have any issues with your neck or jaw, I would have you consider seeing a chiropractor, because very often those things can, the things that the chiropractors can do will help people as well. So consider that approach. It's considered a little bit of an alternative treatment still, but for a lot of chiropractors, they've seen some results with that.
That's awesome. Listen, let's take a break on that note. We'll come back. More calls if you're on hold. Stay there. Our final segment with our guests on Hearing right after this.